Welcome to Guideline Central. I'm Dr. Tabitha Michaud, and today we will be discussing the latest clinical practice guidelines published by the American College of Gastroenterology, or ACG, on January 1st, 2025, titled The Diagnosis and Management of Eosinophilic Esophagitis. Now, this is the first update for this topic since 2013, which we'll refer to as EoE from this point forward. And in this guideline, the ACG uses the grade methodology to provide recommendations for EoE across the domains of diagnosis, treatment, monitoring, and assessment of response, and pediatric-specific considerations. Now, that means for each of these recommendations, there's both a strength of recommendation grading as either strong or conditional, and a quality of evidence grading as either high, moderate, low, or very low. They've also included some key concept statements that are not graded, but do highlight key concepts based on extrapolation of evidence and expert consensus, intended to be framed as advice or considerations rather than diagnostic or management recommendations. Now, the ACG gives 19 EoE recommendations in this guideline, with about as many or more key concepts also included. Now, considering the rapidly increasing incidence and prevalence of this condition, let's get into the guidelines. Now, the recommendations in this guideline are divided into categories based on diagnosis, treatment, monitoring and evaluation of response, and pediatric-specific considerations. So we'll go ahead and start with recommendation number 1 from the ACG, where they recommend that EoE is diagnosed based on the presence of symptoms of esophageal dysfunction and at least 15 eosinophils per high-power field on esophageal biopsy, after evaluating for non-EoE disorders that cause or potentially contribute to esophageal eosinophilia. The quality of evidence for this was low, but this is a strong recommendation. The second recommendation recommends using a systematic endoscopic scoring system, like the EoE endoscopic reference score, to characterize endoscopic findings of EoE at every endoscopy. This was a strong recommendation with a low quality of evidence. Third, we recommend obtaining at least 6 esophageal biopsies from at least 2 esophageal levels, such as proximal, mid, and distal, targeting EoE endoscopic findings if possible to assess for histological features consistent with EoE. This is a strong recommendation with a low quality of evidence. And our last diagnosis recommendation is for a recommendation that eosinophil counts be quantified on esophageal biopsies from every endoscopy performed for EoE. This is again a strong recommendation with a low quality of evidence. Now, diving into our treatment recommendations, EoE does have recommendations for PPIs, topical steroids, dietary elimination, biologics, small molecules, esophageal dilation, and maintenance therapy. For our treatment recommendations, the ACG starts off with a suggestion statement for PPIs as the treatment for EoE. This is a conditional recommendation with a low quality of evidence. They also recommend the use of swallowed topical steroids as a treatment for EoE, and this is a strong recommendation with a moderate quality of evidence. The ACG also suggests for the use of either fluticasone propionate or budesonide in patients with EoE being treated with topical steroids. This is a conditional recommendation with a low quality of evidence. Now, in terms of dietary elimination, the ACG suggests an empiric food elimination diet as treatment for EoE. Now, this is a conditional recommendation with a low quality of evidence. However, the ACG does not suggest currently available allergy testing to direct food elimination diets for the treatment of EoE. This is a conditional recommendation with a very low quality of evidence. Now, for biologics, the ACG does suggest dupilumab as a treatment for EoE in individuals 12 years of age or older who are not responsive to PPI therapy. This is a conditional recommendation with a moderate quality of evidence. The ACG does also suggest dupilumab as a treatment for EoE in pediatric patients ages 1 through 11 who are non-responsive to PPI therapy. This is a conditional recommendation with a low quality of evidence. However, the ACG cannot make a recommendation for or against other medications as treatments for EoE, including cendakimab, benralizumab, lirentelimab, mepolizumab, or reslizumab. However, the ACG does suggest against using omalizumab as a treatment for EoE. This is a conditional recommendation with a low quality of evidence. Now, for small molecules, the ACG does suggest against the use of cromolyn and montelukast as a treatment for EoE as a conditional recommendation with a very low quality of evidence. And in terms of esophageal dilation, the ACG suggests the use of endoscopic dilation as an adjunct to medical therapy as a treatment for esophageal strictures causing dysphagia in patients with EoE. This is a conditional recommendation with a low quality of evidence. Now, for maintenance therapy, the ACG does suggest the continuation of effective dietary or pharmacological therapies for EoE to prevent recurrence of symptoms, histological inflammation, and endoscopic abnormalities. This is a strong recommendation with a low quality of evidence. Now, in terms of monitoring and evaluation of response, the ACG does recommend evaluating response to treatment of EoE with assessment of symptomatic and endoscopic and histologic outcomes. This is a strong recommendation with a low quality of evidence. Now, for pediatric-specific considerations, in children with EoE and dysphagia, the ACG suggests an esophagram for evaluation of fibrostenotic disease. This is a conditional recommendation with a very low quality of evidence. And they also suggest an evaluation by a feeding therapist and/or a dietitian as an adjunctive therapeutic intervention in children with EoE and feeding dysfunction. This is also a conditional recommendation with a very low quality of evidence. And that wraps up the last of our recommendations from the American College of Gastroenterology in their new 2025 guideline on the diagnosis and management of eosinophilic esophagitis. Now, for more information on this guideline and other resources to support your clinical decision making, go to guidelinecentral.com or visit the American Journal of Gastroenterology to check out the full text of this guideline from the ACG.